Hello everyone and welcome to our documentary this week about coronary artery disease. My name is Julia and this is Katie. We are a team of doctors that help to diagnose main heart diseases.
Today we are going to educate you on coronary artery disease. We are going to be taking you through the life of one of our real-life patients, Lexi and her family, to show you how to prevent from getting this awful disease.
This is Lexi and her husband Alex. They're recently married and very happy and healthy. Lexi has a family history of diabetes and was diagnosed with type 2 diabetes just last year. Lexi and Alex both work full-time jobs. Lexi is a teacher and Alex is a dentist. They're both very motivated and excited to start their life together. They come in for checkups regularly.
Hi, Mr. and Mrs. Taylor. How are you?
Hi Dr. White and Dr. Jessamine. We are great. Take a seat up here. Do either of you have any concerns?
No, we're both very active and healthy.
That's very important.
It is.
Okay, so please come back tomorrow at 1 to get your test results. Okay.
Bye.
Bye.
Goodbye.
Hi, thanks for coming back to see us. Your results are in and we have some things to discuss.
Okay, what is it?
You both had excellent blood pressure, excellent heart rate, and you both have the perfect amount of white blood cells and red blood cells. We found no diseases and both of you are very healthy.
Something you'll be pleased to know is that Lexi's pregnant and it's a boy.
Oh wow, that's so exciting. We're thrilled.
Oh, this is amazing. Thank you so much. We'll name him Gus.
So as you can see, Lexi and Alex both lead a very healthy lifestyle.
Although Lexi has diabetes, she still deals with it the best way possible by taking insulin and diabetic pills.
What's more frustrating to you, like, if you're, like, doing shitty golf or hockey? Golf. Like, it's more like...
Mom, can you make me food,
No.
please?
No.
Mommy, will you play with me?
No.
Daddy won't play with me.
Honey, I'm concerned. With all your recent gaining of weight, I think it's time that we go to the doctors and make sure that your diabetes hasn't worsened. I mean, you're looking kind of big lately.
I guess you're right. Hello.
Hi, doctors. We're here because I'm concerned about my wife's recent weight gain and her decision to stop exercising as well as to quit her job. And I'm just really afraid that it's affecting her.
We can run a few tests on Lexi and ask her several questions to ensure that nothing's wrong.
Yes.
How often?
About a pack a day.
Do you drink alcohol?
Yeah.
How often?
About a bottle of wine a day.
Do you exercise?
No, never.
Do you do drugs?
I have used cocaine, not very often, about once a week.
Do you feel depressed often?
Yeah.
Are you stressed?
Yeah.
Are you tired too?
Mhm.
Are you short of breath?
Yeah.
And do you find yourself weak often?
Yes. After asking you those questions and receiving the blood work from the lab, we haven't found anything wrong. You definitely aren't as healthy as you used to be, and you have gained quite a bit of weight.
From now on, we want you to start leading a healthy lifestyle, or else something severe could happen, like a heart disease. Please make sure you stop smoking, drinking, and doing drugs. Also ensure that you exercise and do something to keep your stress levels down. Call us if you have any problems. We are very concerned for Lexi at this point. She has diabetes, which already puts a very healthy person at high risk for heart disease.
There's no way of telling right now if Lexi has a heart disease because although she has low blood pressure, nothing seems to be wrong with the blood. She said she doesn't have any chest pain, which leads us to believe that this isn't any kind of heart disease. But it could lead to one very soon if she doesn't change her unhealthy habits.
God!
Mommy, is everything okay?
911, come quick!
Mommy.
My wife's just had a heart attack. No.
After looking at the series of tests provided, we are sorry to tell you that you have coronary artery disease.
Coronary artery disease is caused by the buildup of plaque in the walls of your coronary arteries. Since the coronary arteries bring blood and oxygen to your heart, this is a problem.
As a result, blood flow to your heart has slowed down drastically, which is what caused your heart attack.
So what do you think has made the plaque build up in our arteries?
Well, it could be a number of things. Some things you can fix, and some things you can't fix. Some examples of things you cannot fix that could have played a role in this is your age, your gender, your race, and your genes.
Many things increase your risk factor for the heart disease, such as diabetes, high blood pressure, and extra cholesterol.
You can do things to help improve your lifestyle that will make you feel much healthier. For example, smoking, drinking, drugs, you have to exercise, continue to eat healthy, and so on.
We have given you antibiotics and treatment to help the plaque move away from your arteries to prevent you from having another heart attack.
As you can see, we spent lots of time taking different tests and x-rays from Lexi's body to try and see what happened.
The first test we did was a coronary arteriography, which is an invasive test that evaluates the heart arteries under x-ray.
The second test we did was an echocardiogram.
The third test we did was taking an electrocardiogram.
The fourth test we did was an electron beam computed cosmography to look for calcium in the lining of the arteries. The more calcium, the more chance of a risk for coronary artery disease.
Once Lexi woke up, we did an exercise stress test.
At this point, we are convinced that what Lexi has is coronary artery disease. To be sure, we did a CT scan of her heart and officially determined the disease that she has, coronary artery disease.
She's gonna make it, son. I know she can do it. Her pulse stopped.
What? No.
She's gone.
Here's some things you can do to treat coronary artery disease.
You can have your blood pressure be less than or equal to 140/90 or even lower for some patients with diabetes, kidney disease, or heart failure.
Glycosylated hemoglobin levels is less than or equal to 7% for people with diabetes.
LDL cholesterol level less than or equal to 100 milligrams, even lower for some patients.
Treatment depends on your symptoms and how severe the disease is.
ACE inhibitors to lower blood pressure and protect your heart and kidneys.
Aspirin to help prevent blood clots from forming in your arteries.
Beta blockers to lower heart rate, blood pressure, and oxygen use by the heart.
Calcium channel blockers to relax arteries, lower blood pressure, and reduce strain on the heart.
Water pills to lower blood pressure and treat heart failure.
Nitrates to stop chest pain and improve blood flow to the heart.
Statins to lower cholesterol.
Never abruptly stop taking any of these products.
Your doctor may also refer you to a cardiac rehabilitation program to help improve your heart's fitness.
Procedures and surgeries used to treat CAD.
There's a coronary artery bypass surgery.
Minimally invasive heart surgery.
It's really important to live a healthy lifestyle.
Some of the risks for heart disease that you can change are:
to not smoke or use tobacco.
Get plenty of exercise, at least 30 minutes a day, at least 5 days a week.
Maintain a healthy weight. Men and women should aim for a body mass index between 18.5 and 24.9.
Get checked and treated for depression.
Women who are at high risk for heart disease should take omega-3 fatty acid supplements.
If you drink alcohol, limit yourself to no more than 1 drink per day for women and no more than 2 drinks per day for men.
Nutrition is important to your heart health, and it will help control some of the heart disease risk factors.
Choose a diet rich in fruits, vegetables, and whole grains.
Choose lean products such as chicken, fish, beans, and legumes.
Eat low-fat dairy products such as 1% milk and low-fat yogurt.
Avoid sodium and fats around fried foods, processed foods, and baked goods.
Eat fewer animal products that contain cheese, cream, or eggs.
Read labels and stay away from saturated fat or anything that contains partially hydrogenated or hydrogenated fats. These products are usually loaded with unhealthy fats.
Thank you for watching our documentary on coronary artery disease.